Thank you, Alicia. Good night, everyone. So I'm a fertility specialist, but I'm going to talk to you about breast cancer tonight. And this slide shows you a curve of the rate of breast cancer over time. And we've known for a long time that estrogen is very important for inducing breast cancer. So there's something very curious when you look at this curve, and that is the arrow shows the onset of menopause, when circulating estrogen levels pretty much go to zero. And yet you can see that the rate of breast cancer doesn't change at all. In fact, it just keeps going straight up. And the reason for that is that the bulk of estrogen exposure in the breast tissue actually comes from estrogen being produced in the breast tissue itself. And only a little bit comes from the circulation. So if you look at the blue bars, those are the relative amounts of estrogen exposure to the breast from the blood or from the breast tissue itself in premenopausal women. The red bars show you what happens after menopause. So the blood estrogen level disappears, but the breast estrogen exposure doesn't really change. It's still about the same. So we came up with the idea that we could make a new hormone replacement regimen, including natural estrogen and progesterone, but adding in an aromatase inhibitor. This is an enzyme that a drug that blocks the enzyme that converts androgen to estrogen in the body. And as a result, what we should see is what's shown in the green bars here, that we can replace some of the blood estrogen levels to get rid of hot flushes and protect the heart and the bones and everything, but at the same time knock out estrogen in the breast tissue. So we did a study to look at mammographic breast density. So this is one of the strongest risk factors for breast cancer. And this slide just shows you what happens to mammographic breast density in women on hormone replacement therapy, which is this first panel. The middle panel is after 2 years on the hormone replacement therapy plus the aromatase inhibitor. And the third panel shows you the difference between those two mammograms, and the colorized image is at the bottom. So on the far right side, you can see how much difference there is in breast density after the 2 years of aromatase inhibitor treatment. So what we believe as a result of this study is that we can develop a hormone replacement therapy that women can take indefinitely without increasing the risk of breast cancer and allow them to get all the other benefits of hormone replacement therapy. Thanks very much.